Hi, my name is Norean Bailey. I had a McKean Fellow in Psychiatry at the University of Iowa. I was in the Fedorowicz lab. So the Department of Psychiatry at the University of Iowa looks at a lot of ranges of disorders. Some of the ones that I got to look at were aging, dementia, anxiety, and neuropsychology. A lot of the research is funded by the National Institute of Health, and there are several publications that come out annually. So the scope of my fellowship consisted of looking at my site mentor's research, which looked at anxiety disorders with an emphasis on bipolar disorders and vascular disease. I was also able to explore the intricacies of research and clinical work. I also shadowed clinical subspecialties to kind of expand my experience, and I got to pick a topic of my choice, which I'll allude on later. So the ongoing research projects by my site mentor were antipsychotics and vascular function and bipolar disorders. I also looked at irritance measurement abnormalities and seasonal affective disorder, as well as functional and T1 row imaging and bipolar disorder. So initially I shadowed an MRI clinic, so I was looking at the differences between structural and functional imaging, since I hadn't really seen a lot of MRI scans. And so structural imaging really looks at bone, tissue, and blood vessels and tumors, while functional imaging really reveals more of like the blood flow and the chemical connectivity. So that gave me more of a clear picture of how the brain, like cortical limbic pathways, connect to each other. Neuropsychology was another specialty I looked at. So I really didn't understand the intricacies of neuropsychology until I shadowed. And so they really evaluate and diagnose neurological conditions that affect behavior on thinking skills. One of the patients that I got to sit on was being screened prior to a surgery, so they would understand the intricacies of the surgery, so they would know how like post-op care would be taken. And the Wechsler Adult Intelligence Scale is a scale used to measure that competency level. So the paper of my choice was white matter degradation and generalized anxiety. I picked it because anxiety was one of the main focuses of the lab I was working in. I also was able to shadow a Huntington's disease clinic, and so that's a neurodegenerative disease. So before I was able to really understand how neurodegenerative processes occur, that was a really good segue into my interest in white matter. I was also exposed to a lot of fMRI scans in the MRI lab that I talked about previously. So essentially, the general logistics of my paper looked at emotional processing and the integrity of like functional distributed neural brain circuits, including cortical limbic pathways. So the literature highlights a lot of the anterior cingulate cortex, the amygdala, the prefrontal cortex are the most researched. And initial insights indicate that mood and anxiety disorders are characterized by disorder-specific structural alterations. However, generalized anxiety is one of the poorest examined disorders. So the importance, again, is just identifying the neurobiological underpinnings and understanding the development and maintenance of this disorder. Generalized anxiety disorder, when it's diagnosed, is often given with comorbid associations. So I looked at how it could provide a clearer classification of the mental disorder and how that could improve clinical applications in the future. So gains from this fellowship, I really understood the intricacies of research. I've emulated that a lot in my coursework and as a psychology major, and just being able to see that in a professional setting. The connections between biology and psychology, oftentimes mind-body dualism isn't really explained. And so it was really great to see that connection between physiological factors and psychological factors. And just a knowledge of antipsychotics and vascular function, which I really didn't know much about until going into my fellowship. It also presented a lot of opportunity for independent study and topics for class papers. I just wrote my senior thesis on white matter degradation, so that allowed me to delve more into what I was working on during the summer. It narrowed my career interest. I went in interested in clinical psychology, and now I have much more interest in neurology and pursuing a medical degree. And it pushed me past my comfort levels to complete tasks. I didn't understand how complicated search bars were until I had to search for my papers. So PubMed and I became really good friends. And again, just coming back to my interest in neurology. So professionally, I was able to network with professionals in the field. There was med students in the lab that I was working in, so I could talk to them, engage their experiences. A lot of PhD students also. And again, it gave me research experience in a professional lab. So I narrowed down my career goals. I was able to grow professionally and academically by going beyond my comfort zone, and it fostered a sense of accomplishment and self-confidence as I feel like I have a really good grasp on this topic now. So with gratitude, I'd like to thank the Cornell Fellows Program for providing this opportunity, my site supervisor, Dr. Jess Fedorowicz, and my faculty sponsor, Dr. Melinda Green.